Hello, how you doing? My name is Shavonda and I will be taking the time out to talk about leukemia. By the end of this speech, you will understand leukemia. You will know how to get tested for leukemia. You will know the symptoms of leukemia, the treatments. You will know 4 main leukemias, and you will know 2 less common leukemias by the end of my speech. Okay, leukemia is a cancer of the blood cells, and it starts in the bone marrow. That's where the blood cells are located. The white blood cells is the main blood cells that help fight off infections. When the white blood cells are normal, they form a leukemia cell, which is known as leukemia. The diagnosis. I have to get tested to see, do you have leukemia? You have a test called the complete blood count, which is also is CMBC. It is one of the several most common leukemia tests. It counts the amount of red blood cells, white blood cells, and the platelets that are in the blood. Another way to get tested is a biopsy, which is a small removal of the amount of tissue to determine the type of leukemia and the growth rates of the tumor, whether it's spread. The next type is a Lummer's puncture. It's another name for a spinal tap, which that they takes the fluids out of the spine or your lower back. The next type way to get tested is a chemistry. It is known to use the dye to see if you have any cancerous cells. Another way is a liver function test. It's a group of blood tests used to measure the amount of enzymes in the liver. And the last test is an imaging test. They are tested to use the imaging technologies to produce pictures of the inside of the body. Okay, there are 4 main types of leukemia. The first main is acute lymphoblast leukemia. It is a type of cancer that causes the body to make too many white blood cells. This can be caused infection, anemia, and easy bleeding. It usually gets worse. Growth usually occurs in a child between 2 to 5, but in adults can also get it. The next type of blood cancer is an acute myelogenous. It's a type of cancer that is called in the blood to make a large number of white blood cells. This is common in men and women. It is also common in children with Down syndrome or other genetic diseases. Another is a chronic lymphocytic leukemia, and is a type of cancer that is causing the body to produce a large number of white blood cells, and more common in men and rarely seen in children. The fourth and not least is the chronic myelogenous leukemia. It's the type of cancer that is causing the body to produce a large number of white blood cells. CMS is also another short name for chronic myelogenous leukemia. It is more common in men than women. It occurs more frequently in adults in their 50s, and it is rarely seen in children. Most people with CML have gene change and that is called Philadelphia chromosomes. The 2 least common leukemias is a hairy cell leukemia. It is very rare cancer because the body makes too many white blood cells. It's get the name from when you look at it through a microscope, it looks like little hairs. It has not been seen yet in children or teens. Acute promolactic leukemia, which is the type of blood cancer, APL, is also another name for it, and it is a life-threatening bleeding. Okay, people with APL need special mix of cancer treatments to fight off the cancer cell growth and control the risk of high bleeding. Treatments. There are very several treatments that you can do for leukemia, which will start with the chemo treatment. Chemo treatment is a drug to fight off cancer. The goal for it, the introduction, is to kill the leukemia cells in the bone marrow and induce remission. The goal for consolidation is to kill any leukemia cells that may be presented, even though they don't show up in a test. The goal for maintenance is also prevent any remaining leukemia from growing. That's the goal of chemotherapy, which we also call chemo. Another way of therapy is radiology therapy. Use the doses of radiology such as X-rays to destroy a cancerous cell. Radiology is usually given in the form of a machine outside the body that directs radiation to the cancer. Another way of is stem cell transplant. Donates the cell from a matched donor that can rebuild your supply of normal blood cells to your immune system. And clinical trial is when people have leukemia and may enter a reasoning program when they first start treatment or leukemia is getting worse. Those are the main thing. And symptoms. There are symptoms to leukemia: fever and night sweats, brushing or bleeding, headaches, bone and joint pain, swelling of the lymph nodes, getting a lot of infection, feeling very weak and tired, losing a lot of weight and not being hungry. Those are the symptoms of leukemia. Just because you have those symptoms don't necessarily mean that you have leukemia. But leukemia is mainly, when you getting treated, is mainly from. So let's go over everything that we have learned in this seminar about leukemia. Leukemia is the cancer of the blood cells, and it starts with what the bone marrow and where the blood cells or white blood cells are located. So the easiest way to remember what is a leukemia, it is the weakness of the white blood cells. Okay. The ways to get tested is a complete blood count test, biopsy, lumbar test, a flow compensatory, a linear function test, and an imaging test. Those are the tests that you can use to get tested to see that you have leukemia. The four main types of leukemia: acute, ALL, AML, CLI, and CML. Those are all the shortness of the leukemia. Okay, the treatments: chemotherapy, which is main stem cell treatment, and clinical trial and radiation. Those are all the treatments of leukemia. Thank you, and my name is Shavonda Nelson.